One. Here we go. We're live. And I'm not going to sing tonight because one of my sons who does our IT work for us declared that that is has a lot of cringe value, Mom. Don't sing anymore. So I've stopped singing. Hi, Elaine. I mean, I sing around the house all the time, but instead, as Scott Adams would say, we're going to take the simultaneous sip. For those of you who don't know Scott Adams' podcasts, you might enjoy them. He's a pretty interesting guy. I follow him here and there. Yes, Elaine's from Illinois. Lynn, hi. Francine from Ohio, and Joanne from Tennessee. Sandy from Indiana. Hi from Fishers, Indiana. I didn't know there was such a place as that. Anja, pretty name. Dawn, hi Dawn from Maryland. I know that you're from Maryland. I remember. Hi. Nice to see old faces. You like my singing? Thank you, Elaine. But the thing is that my son does all of my IT work, and he has to listen to my podcasts and my interviews, and he listens to them all day, and he says, oh my gosh, I'm so tired of hearing your voice. And then he works in the office with me too, so please keep singing. Oh, all right. Please sing. All right, I will get back to it again. I'll sing. I know. I love it. I sing all the time. West Monroe, Louisiana. I used to live in Baton Rouge, South Carolina. Hi, Tracy. Holy Cross Farm again. Hi. This is Michelle. Baby number 12 arrived on Monday. August 5th. Sepia and Arnica for Afterbirth are amazing. You bet. Oh, I'm so happy for you. And listen, Michelle, if you need more of that sepia, you can always, and Arnica, you can use it even after this much time. August 5th, today's the 12th, so that was a week ago. 1 week old baby number 12. God bless you and your family. Michelle, hi Michelle from California. Wanda from Ontario. Yep, hi Ontario. Hello from Ohio. That's Kathy. Another Kathy. Hi Kathy Diaz, yes, from Madeira Beach, Florida. Oh, it's so much fun to see everyone. Betty from Utah. Nina from Illinois. Singapore, Amir Khan from Singapore. How exciting. Gives me goosebumps. Indiana, Jean Ann. Natalie, we call her Nathalie because she's got that extra H, that extra consonant in the middle of her name. Vicky from Ohio. Lynn from Rockford. Wonderful. Back desk sitting in Kentucky. Hi, Sue. Yes, keep singing. Okay, I'll do it next time. I will sing. Love your singing in Tennessee. What's that? Nepal. Yeah, Nepal. Who's from Nepal? I don't see Nepal yet. Oregon, Montreal, North Carolina, St. Louis, Rachel. Beautiful, beautiful. Yes, Bal Mukunda Tulachan. Bal Mukunda, beautiful name. Talachan, I think it is, Talachan. Nice to meet you. Tammy Perkins, nice easy name for me. From Georgia, very nice. Saratoga Springs, love you. Aren't these flowers great? We had friends over for a barbecue yesterday, friends and relatives, and my friend brought this from me from her garden. And then she put what I thought was a little banana peel in there, you know, to cover up the little rubber band that she organized them with. And she tells me it's not a real banana peel. And then I checked it out, and she's right. It's a paper that looks like banana peel that you buy from the floral supply store. And I'm buying some. I can't wait to do it. Yep, from Georgia, Saratoga Springs. How nice to see everyone. Okay, so tonight, this is not going to be very long. This is a really simple homeopathic medicine, and I learned this from Dr. Ramakrishnan, and I studied with him for about 5 years in Toronto and then New Jersey. couple of times we met in New York. Our group met in New York. And he taught us this, and I have found it to be absolutely a spectacular medicine for chemotherapy and for radiation therapy from the ailments from having been exposed to. So it's while the person's taking chemotherapy, while they're on radiation therapy, this helps with the, oh, here's someone from Australia, very nice, and the Philippines. Oh, I love this. And you will find, if you have someone like this, that it will really comfort them a great deal because it backs down the vomiting and the weakness, but mostly it's the vomiting. And it will not interfere. I know doctors think it's going to interfere. But listen, conventional doctors don't know what homeopathy is. I wish they did. As a matter of fact, parenthetically, let me tell you that I actually believe that the way homeopathy is going to live on in the future is that it will be integrated into modern medicine, and conventional doctors will use homeopathy without realizing that it's homeopathic. They'll just use it because it works. As a matter of fact, I'll tell you a quick little story. And boy, now that I'm going to tell the story, I wish I had prepared and so that I could remember this fellow's name. He was the pharmacist at Hahnemann Pharmacy outside of San Francisco. If anyone remembers his name, he's the owner, and he's passed away. His wife has taken over this pharmacy. Very good pharmacy, by the way. Hahnemann Laboratories, Hahmann, named after Dr. Samuel Hahnemann, the father of homeopathy. Many years ago, he decided that he was going to use arnica and make it and put it into blister packs, and not call it arnica, but instead call it Sinnec, Sinnecc, named after ecchymosis, which means black and blue. And so what he did is he marketed it differently, and he went to oh, for goodness sakes, plastic surgeon events. They're events where he had a table and he gave it away for free to get them to start using it. And the directions on it said, the day before you use this, and it's a little capsule, it's not the typical looking homeopathic pill that he put in there. The day before, the night before, the morning of, as I recall, and then you use this potency for these 3 doses, and then from that time forward you use this potency, and he didn't call them potencies. He had it on a card and a blister pack, and you open the card and it gave all the exact directions. Brilliant. So I have actually come across plastic surgeons who have told me that they've been using Sinnec for years, and he didn't label it. He used a secondary name for his corporation, for his company, and instead of using Hahnemann Laboratories, he called it, I think, Alpine. I wrote an article about it many years ago. I think it's fascinating. You can still buy Sinnec from that pharmacy. It's a great idea. It would be used for, especially for plastic surgery, because when plastic surgery has been completed, one of the biggest complaints that most patients have is that they're all black and blue and for a very long period of time. And so this eliminated that, not to mention the pain and the potential for infection. So it was integrated. The surgical, these doctors had no idea, or many of them had no idea that it was homeopathy. And what did they care? It worked. It was useful. Their patients were happy, hence they were happy, and that's the way this should work. So one of the reasons, I'm going to go on with this tangent just a little bit further. One of the reasons that I love the method that I teach, this method of homeopathy that I call practical homeopathy, mostly based on the Banerjee protocols, is that it's reproducible. We don't have a classical setting where we have, let's say, one patient and 50 or 100 homeopaths, and I've been in those settings in our classes in Toronto and New York, etc. And then when the patient leaves, we all come up with the medicine that we think is the most useful for this patient, and you can only choose one, generally speaking, in classical, and there'll be 15 answers. But with this method, it's as simple as, this is the condition, this is the potency, or this is the remedy, the potency, and the frequency. Because even if you come up with 15 different homeopathic medicines for this one person, and you can't decide, and then you just have to go eeny, meeny, miny, mo, you still have to come up with the potency and the frequency. So this method is formulaic. And this is what I teach on the blog. This is what I teach here. And so tonight, I'm going to give you this medicine that is downright formulaic. Now, I'm not going to tell you it's going to work in absolutely every case. Generally speaking, we see most of these medicines, at least the Banerjees have found with their protocols, that it acts on approximately 85% of those folks who are suffering from that particular condition. I don't know about this one because this is not a Banerjee protocol. I did not see them use this. I don't know if they don't use it. They do use, I know the medicines they do use, but I'm going to use this one tonight because I've had such good results with it. And the medicine is called Cadmium sulphuricum. Cadmium, just the way it sounds. C-A-D-M-I-U-M. Cadmium. Second word is sulphuricum, just the way it sounds. S-U-L-P-H-U-R-I-C-U-M. And of course, Nathalie is going to be writing it out for you so that you have this. This remedy is used for persistent vomiting, any attack on the stomach, soreness in the part of the stomach in response to pressure, violent nausea, retching, and there's often black vomit. I'm reading this directly from my Materia Medica. You see, it's not very long. It's just another sentence on the next page. Cadmium sulph is used for vertigo, where the room and bed seem to spin around, hammering and heat in the head, night blindness, distortion of the mouth, trembling of the jaw, facial paralysis, especially on the left side. The person has a need to keep quiet and tends to feel cold even when near a fire. Now, we're not using this necessarily for just these conditions. It doesn't mean we can't use it for these conditions. But I'm specifically teaching tonight that you use this around chemotherapy and radiation therapy. Symptoms become worse when walking or carrying burdens after sleep from open air and stimulants. Symptoms become better after eating and rest. This is Dr. Ramakrishnan's go-to medicine for nausea and vomiting from chemo and radiation therapy. And I've used it in the 30th potency. That's how he taught it, to use it in the 30th potency. I've never gone any further than that. It can be taken along with the allopathic treatment. Just remember that. So if someone's getting chemotherapy and they go, uh-oh, I'm in trouble, I feel nauseous, and some of those other symptoms I just mentioned, they don't need to be present, but if they are, you've got a dead ringer. And also you can use it for after the treatment for as long as those symptoms remain. As always, it will not interfere with allopathic medicine. So that's important to know. And I'm going to back up a little bit. Pardon me? Say it again. Cadmium, C-A-D-M-I-U-M, sulphuricum, S-U-L-P-H-U-R-I-C-U-M, 30. Usually 30C because that's easier to find these days. There was a time when we could only find 30X in the U.S. For a long time in the 70s and 80s, but then it sort of switched around, and I think that was due to boron coming in on the market. Boron is the one with the little blue tube, and they really changed the market in many ways. So you're not going to find this necessarily at your health food store. I think you might find it on Amazon. If you can't, maybe you do want to check with Boron directly. And if not there, then Washington Homeopathy, Hahnemann Pharmacy, and also maybe for that Cynic. You know what let me just go back to that Cynic again, that story. If you have a member of your family who is so skeptical of homeopathy and they have to go in for surgery and they are not comfortable with it, buy them Cynic and give them the pack and let them follow the directions. It won't look foreign to them. See, this looks foreign to people, that you have to twist the top and then you pour out the little pills and then you put them directly into the mouth. But this other method looks just like conventional medicine. It looks like something your pharmacist would give you. So it might make them feel more comfortable and more readily interested in that. So consider that for surgery, before and after surgery, for someone that you know who questions that. And then cadmium sulph, I don't, it's not that uncommon a medicine, but it's not one of the more common ones, and you certainly won't find it in a kit. Let's see what we've got here for questions. You're absolutely right. It can't happen soon enough that doctors start using homeopathic medicines. See, the problem is, in my estimation, there's been too much of a schism. And hey, it was allopathic's fault, as far as I'm concerned. They went after the homeopaths, the conventional homeopaths, back in the 40s. And they made enemies of them. And they've been pretty much enemies ever since. And of course, now we don't see homeopathic medical doctors in the US. Very, very, very rarely do you see that. Because you can imagine they're not going to go to medical school for 4 years and then internship and then residency and then start all over again and go to homeopathy school, which is another 4 to 5 years, depending on where you go. So let's see, would it work for dark circles under the eyes? No, I don't look at it that way. Looking forward to the day when functional and integrative medicine routinely prescribe homeopathy. Long overdue, you bet, you bet. A few months ago, my husband was given belladonna along with an opioid in the emergency room of our local hospital. Yes, and you know what? Belladonna probably would have done the trick. Belladonna, and if they gave an opioid, it could have been, of course, for pain. Hypericum is also a very, very good one. We're starting to put together, very slowly, but we're starting to put together a course on pain. Just pain. Pains, no matter where they are. I'm really looking forward to this course. We can really tighten up and teach an awful lot. Senec, no, it's not. It's called Synec. Here, it's in my drawer there. Synec. You could probably find it. I should have pulled it out. This is so extemporaneous, in case you can't tell. I don't really give it a lot of thought what I'm going to be talking about other than the particular medicine. Oh, you love my Materia Medica. Thank you, Kathy. I appreciate that. Cadmium sulphuricum 30. That's right. Thank you very much for writing that out. Cadmium sulphuricum. Could you address, pardon me? Oh, Michael Quinn. Thank you. Michael Quinn, I should not forget his name. He was a good man. I met him once. I've met his wife, and we spent some time together at the pharmacy. I met him only briefly once at a conference. He would never have remembered me. But I think she might remember me because we've spent a lot of time there. And let's see. Homeopathyworks.com is a great source as well. That's right. What do you suggest is best for depression and anxiety? Okay, if you're looking for depression and anxiety medicines, go to my blog and do this. Or you don't even have to go to the blog. Do this on your browser. Joette Calabrese Depression. Joette Calabrese Anxiety. And you will find the medicines that I feel very strongly about can do a lot of good. Does it treat hot flashes from chemotherapy? It might. It's more likely to cause when chemotherapy causes, could be in the combination drawer, and it would still be in the original box. I don't think that's it. My husband's looking for Synec. It would be, really? Oh, well, that's not the whole pack, but it's Synecch. Synec. Now, it was in a folder, an entire folder. I must have taken it out, but you see how they. Look at that. Doesn't look anything like homeopathy. It looks like conventional medicine. And so this is day 1, or this is day 2, or the second dose. This is day 3, day 4. This is the next one, the next day, or the next day is probably here, and the next day. I don't know exactly how it works. You have to read the directions. But is this, oh, here it is. Pre-op, here. That's the one you take. Day 2, day 3, day 4. Post-op, here. Day 2, day 3, day 4. Bedtime day of the surgery. Day 1, day 2, day 3, day 4. It's just brilliant. Michael Quinn, brilliant. He's no longer with us. He passed away some years ago. But remember, you can purchase this, so it's a good one to know about. So, Synec is on Amazon. Thank you, Francine. Very nice. Looking forward to a pain course. Does it treat hot flashes? It might help with hot flashes. If, however, it doesn't, then you go to specific hot flash medicines. Can you list the names of the other, companies to buy homeopathy medicine from? Okay, boron, Highlands, Hyland', Washington, they're in West Virginia. What did I just say? Hahnemann Laboratory outside of San Francisco. If you're a student or a client of mine, OHM, they are a wonderful pharmacy, but they're not retailers. They only accommodate practitioners, their students, and clients. I like Helios in England, and there are probably a couple others that I'm missing, but don't just buy it from anyone, and be sure you buy American. Now, boron is French, so buy American, French, German, Swiss, Italian. Don't buy from India, folks. As much as I love India, don't buy from India. Don't buy from China. Okay. Yes, chemotherapy causes, yes, Michelle, causes chemically induced menopause. That's absolutely so. Yes, thank you for mentioning that. With the opioid crisis, it would be great time for your pain class. You bet. Absolutely. Let's see. Joette, you make learning homeopathic medicine learning so enjoyable, and you make total sense. Thank you so much for all your help. You are welcome. Aquase Way. That's another beautiful name. Should arthritic ails after chemo be treated with arthritis protocol? Yes, absolutely. And of course, 1-800-homeopathy. Yes, 1-800-homeopathy is actually a derivative, I believe, of Highlands.
TX options.
Pardon me? TX options. Yep. Helios. Yes, I like Helios very much. Boron. Hi, thank you, Natalie, for telling us. Boron, Highlands, Washington Homeopathic, OHM, Helios. Okay, a family member had radiation for prostate cancer, and now as a result has something going on in his sinuses and has swollen temples and fluid running to his chest and causing bronchitis. Do we treat the bronchitis? You bet. Regardless of the cause, folks, if you know the cause and you have a medicine that's specific for the etiology or the cause, then by all means, use it. But if you don't know it or you don't have that protocol, go right to the protocol that's specific for the condition that is presenting. Tinnitus. I have a blog on tinnitus, Tracy. Take a look at that. Yes, I went to instant menopause after chemo. You bet. Thank you. Thank you. What to do for AFib. I talk about AFib. We talked about AFib on the blog. No, but you know where it is? If you use my name, Joette Calabrese, Wise Traditions. I have an article that I've been authoring, or a column I've been authoring there for nearly 10 years, and I'm almost certain I've written about it. In fact, here's another thing you can check out. Use in your browser, Joette Calabrese, My Dad and the Dead Cardiologists. And osteoporosis, I talk about that in my course, Feminopathy, but I also talk about that on my blog. Got it right there. Essential tremor, I don't have anything. I deal with that frequently, but I don't have anything written on that. Elaine, super dry mouth from chemo. So it's worth trying cadmium sulf for something like that, but I'm not going to tell you that that is an absolute. Instead, I would go with a cell salt. You might want to check that out. You mentioned NatPhos 6X and 5 is okay to use, as I don't find 6X. NatPhos 6X is 5. I suppose you could use, yeah, I suppose it's, look, it's interesting. In the US, we use cell salts, the 12 cell salts in a 6X, and except for occasionally we use calc fluor in a 12X. It's just the way we've done it. Same thing in Europe. Then I went to India and worked with the Banerjees and the doctors and I learned that they use cell salts, generally speaking, not always, but generally speaking, in a 3X. Now, I did not ask a lot of questions when I was working with them for those 8 years, 8 returns, because I didn't want to burden them with my questions. I assumed I would learn in time because I was seeing so many cases every day. But I did ask about the cell salts because I saw time and again it was always 3Xs. And Dr. Prateep Banerjee gave me a very succinct curt, but not unkind, always polite. He was always a gentleman. Answer. And this was his answer. We use 3X because we find that it works. So it's interesting. You can play around with potencies. You can use a 5X. You could use a 30X. But as I always say in my blog, when people say, well, I don't have that potency, can I use this potency? I always say you can use any potency you like. And if you have no choice, then of course, and you're in trouble, by all means, use what you've got. But if you expect to see the kind of results that I have grown to enjoy and to observe, then go use the potency that I teach. Cyclical vomiting. If this vomiting is cyclical in relationship, especially to chemo or radiation, by all means, yes. But it can also be related to, unrelated to that. Now, I did a course called Good Gut, Bad Gut. Should you ever be interested, I talk a lot about nausea, vomiting, etc. What course covers diabetes? That's Good Gut, Bad Gut. And any ideas for fluid on the knee and or Baker's cysts? Do we have anything on that? Here's the thing, fluid on the knee, I'm assuming it's only the knee and it's hot and swollen, and I think, have I done a blog on that? Edematous knee. Check that out. Just Joette Calabrese-Edematous knee. I don't like to go too far off from the subject of the night. So as you can see, I'm only kind of giving you hints as to where to go instead of actual answers. All righty. I think we have got it. It's a good night. It's very hot here in the north, moist. Hope it's comfortable where you folks are. And I wish you a very good evening, and God bless to all of you. Study, learn, and pass it along. Good night, everyone. God bless.